Diabetes is a chronic condition in which the level of blood sugar, glucose, is elevated. When the body cannot properly use or produce insulin, a hormone that regulates glucose in the blood, glucose levels can build up in the blood and cause various health problems. There are three main types of diabetes. Type 1 diabetes. Type 1 diabetes is an autoimmune disorder in which the body's immune system attacks and destroys the insulin-producing cells in the pancreas. This type of diabetes typically develops in childhood or adolescence and requires lifelong insulin therapy. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes, accounting for around 90% of all cases. In this type of diabetes, the body becomes resistant to insulin or does not produce enough insulin to regulate glucose in the blood. Gestational diabetes. Gestational diabetes is a type of diabetes that occurs during pregnancy. It usually goes away after delivery, but women who have had gestational diabetes are at an increased risk of developing type 2 diabetes later in life. Symptoms of diabetes may include frequent urination, excessive thirst, blurred vision, fatigue, and slow healing of wounds or sores. Long-term complications of diabetes can include nerve damage, kidney damage, eye damage, cardiovascular disease, and stroke. Treatment for diabetes typically involves a combination of medication, lifestyle changes, and regular monitoring of blood sugar levels. There are several classes of drugs used to treat diabetes. Here is a brief description of the main classes of diabetes drugs. 1. Metformin is a medication that decreases glucose production in the liver and improves insulin sensitivity in the body. It is commonly used as a first-line therapy for type 2 diabetes and is generally well tolerated. The most common side effects of metformin include gastrointestinal upset, such as diarrhea, nausea, and abdominal discomfort. 2. Sulfonylureas are medications that stimulate the pancreas to produce more insulin. Examples of sulfonylureas include glipizide, glyburide, and glimepiride. These medications can be effective in lowering blood sugar levels but can also cause hypoglycemia and weight gain. 3. TZDs are medications that increase insulin sensitivity in the body and decrease glucose production in the liver. Examples of TZDs include pioglitazone and rosiglitazone. These medications can be effective in lowering blood sugar levels but can also cause weight gain, fluid retention, and an increased risk of bone fractures. 5. DPP-4 inhibitors are medications that increase insulin secretion and decrease glucose production in the liver. Examples of DPP-4 inhibitors include sitagliptin, saxagliptin, and linagliptin. These medications are generally well tolerated but can cause headaches, upper respiratory infections, and inflammation of the pancreas. 5. GLP-1 receptor agonists are medications that increase insulin secretion, decrease glucose production in the liver, and slow the absorption of food in the stomach. Examples of GLP-1 receptor agonists include exenatide, liraglutide, and dulaglutide. These medications can be effective in lowering blood sugar levels and promoting weight loss but can also cause nausea, vomiting, and an increased risk of pancreatitis. 6. SGLT2 inhibitors are medications that block the reabsorption of glucose by the kidneys, leading to increased glucose excretion in the urine. Examples of SGLT2 inhibitors include canagliflozin, dapagliflozin, and empagliflozin. These medications can be effective in lowering blood sugar levels and reducing the risk of cardiovascular events but can also cause dehydration, urinary tract infections, and an increased risk of ketoacidosis. 7. Insulin is a hormone that regulates blood sugar levels by allowing glucose to enter cells to be used for energy. Insulin can be delivered through injections, pens, or pumps. There are several types of insulin, including rapid-acting, short-acting, intermediate-acting, and long-acting. Insulin can be effective in lowering blood sugar levels but can also cause hypoglycemia, weight gain, and injection site reactions. It's important to note that the choice of medication and the dosage will depend on several factors, including the patient's individual health status, medical history, age, weight, and lifestyle, as well as the severity of their diabetes. Patients should always consult with a healthcare professional before starting any new medication or changing their treatment regimen.